Hello, I'm Dr. Chandrani, obstetrician and gynecologist in Bhagirathi Neotia Women and Child Care Center, Newtown. Today I'm going to discuss about a topic which is pre-labor rupture of membrane. Now what is it? Normally in the mother's womb, the baby is protected by a bag of membrane which contains water, that is the amniotic fluid. This water normally breaks just before you are into labor or during the active labor. But what happens if it breaks early? That is what we called PROM or pre-labor rupture of membrane. Now it's a very serious condition because this bag of water protects the baby from outside infection. And if this PROM happens before 37 completed weeks of pregnancy, it is called preterm pre-labor rupture of membrane. Now how will you know it has happened? Sometimes you may feel a gush of fluid leaking in, or you may just feel damp. So if there are any confusion that you are feeling damp down below, we always advise you to wear a pad, check the color, the amount and the smell of the fluid, and you should always contact your gynecologist. You should reach the hospital because sometimes it's very difficult to know whether you are actually leaking water or it's urine or just normal vaginal discharge. In the hospital, you will be checked. Your thorough history will be taken. Your doctor will check your pulse, your temperature, your baby's heart rate, and you will be offered an internal examination. Internal examination to check whether you are actually leaking or not. Then some tests may be advised, like some blood test, some ultrasound, and depending on the findings, you may be either offered delivery, immediate termination, or you may be offered observation to see how you and your baby is doing. Because sometimes if this happens in your pregnancy before term, there is a very high chance that your baby may get an infection which may progress to a serious infectious condition which we call chorioamnionitis, and that can make you as well unwell. So if you are advised observation, you should very meticulously notice the amount of fluid, whether there is any color change, whether there is any change in the baby's heartbeat, or you are developing any pain or fever. So please don't panic. You may also advise some antibiotic, and you should be very cautious and you should be monitored very meticulously. In that case, you don't just panic, be cautious and always contact your obstetrician for opinion. Thank you.